Live from Studio 46, this is CBS 2 News.
In tonight's Health Watch, growing hair with your own blood. Sound too good to be true?
There are a number of legitimate studies now showing that it's possible with something called Platelet Rich Plasma, PRP for short. Dr. Max Gomez here now with more on this one. The same technique apparently used to treat muscle and tendon sprains. Doctor.
That's right. And, PRP has long been used to treat everything from tennis elbow to even back pain, but with some mixed results. Some athletes have gotten tremendous benefits and others not so much. But some improved technology now looks like it can put PRP to work growing hair.
My wife has informed me I've been thinning on the crown.
It's the classic male pattern balding, hair follicles going dormant on the crown of Ron Woody's head. But hair loss is a problem for women, too.
When I'm in the shower, it comes out. The bangs in front was all gone.
Camilla Singh has what looks like a very full head of hair, but she noticed her hairline in front was receding and she was losing hair on top, too. And neither she nor Ron wanted a transplant or lifelong medication use to hang on to their hair. So Camilla came to see Dr. Bruce Katz, who explained she hadn't actually lost her hair follicles.
They're actually still there, but you might see a little peach fuzz, but they're basically dormant.
To wake up those sleeping follicles, Dr. Katz and others have turned to platelet-rich plasma, or PRP. First, some blood is drawn from Camilla, which is then spun down in a centrifuge to separate out the platelets in the plasma. Then the platelets are activated, so they can secrete the compounds that are thought to be responsible for hair growth.
They actually produce new stem cells in the root of the hair follicles, and this sort of wakes up the hair follicles and they start producing hair again.
The activated PRP is injected into the areas of the scalp where the hair is thinning. This particular system uses a kind of matrix that keeps the platelets in place for up to 7 days, so the growth factors have a chance to really work. Hair regrowth results have been published for both men and women. Camilla's had a few treatments that grew back her hairline, and Ron had 4 treatments a month apart, and his hair growth is clear. More importantly, what'd your wife say about it?
She was quite pleased.
I guess so. Now, the PRP treatments work best before a person gets shiny bald and the hair follicles are in deep sleep. Cost is $500 to $600 per treatment, and you'll usually need 4 to 6 treatments a month apart. It's not cheap, but it's a lot less than a hair transplant, of course, or years of medication use, and it is cosmetic, so there's no insurance coverage for this.
This is true. So you got to have hair to get some more hair.
Well, you got to have some dormant hair. You're starting to lose it, but if you're shiny, maybe it's too late.
Sorry.
You need to wait for the next invention for that.
Oh, man. Thank you, Doctor.
Thank you, Dr.
You bet.
Max.